This original WSRE presentation is made possible by viewers like you. Thank you.
Hi, I'm Dee Dee Sharp, and welcome to part 2 of this An Aware Town Hall Forum on the Affordable Care Act. We're glad to have you right there with us. Now, in part 1, we defined the law. We talked about health insurance exchanges and subsidies, individual mandates, and even pre-existing conditions. We also looked at the impact of the ACA on Medicare and Medicaid. Now we want to help you find national and local resources to help you choose the best insurance options for you and your family. To do that, we have assembled a panel of experts who will answer questions from our town hall audience and from you at home from some of your email. We want to now introduce you to our guests, including Andrew Rubin. He's the Vice President for Medical Center Clinical Affairs and Affiliates at New York University Langone Medical Center. Next, we have Matthew Pinzner, Senior Director of Managed Care, also from NYU Medical Center, and Allison Vogel, Vice President of Managed Care at NYU Langone Medical Center as well. And by the way, they are all from Healthcare Connect, which airs nationally on Sirius XM Doctor Radio. And here locally with our experts, we include Stephen Rome, spokesperson and volunteer advocate with the American Association of Retired Persons. Most of us know that as AARP. And last but certainly not least, we have Corey Brown, a licensed navigator with Families Count. We want to thank each and every last one of you for being here with us on The Aware Show. We want to get started now because the whole goal of this is to educate our viewers and our town hall audience to what all of this means to them. We keep hearing a lot of information that kind of makes this more complex than what it might actually be for us if we would just educate ourselves and get informed. And that's what we do here on The Aware Show. We're going to start with one big question for all of you. Any of you can answer. Why are so many people, so many Americans against improving health care? That's one of our questions from our audience members, by the way, here at the town hall.
I think I'll start on that one. I think if you ask people about the Affordable Health Care Act or Obamacare, they may say they're against it. This is part of the political aspect that Andrew talked about. But if you ask them about each individual improvement to the healthcare system that the ACA provides, no lifetime limit on out-of-pocket expense, no yearly limit on out-of-pocket expense, adult children can be on the policy until 26, free immunizations, or no copay for immunizations and preventative medicine, they'll say they're for it. And I think this is part of the problem we have with taking the politics out of the Affordable Care Act.
I mean, how many times do we get a call on the radio show, Allie and Andrew, where someone calls it and they're against it, and we say why, and they can't really articulate it. And then we say, well, here's some of the good things about it. And by the time the call's done, they're like, oh, maybe I will get into this and look at this some more. That sounds like good stuff.
60%, but recent polls, 60% of Americans are against the Affordable Care Act, and the same survey questionnaire says, do you know what's in it? And only 30% of the people can actually answer what's in it. So it just shows what they're saying is true.
And a lot of people don't really, are fortunate enough that they haven't really struggled through the healthcare system to have to know what it could be like if they didn't have access to healthcare. I myself, I've been very lucky. I've had health insurance since I started working out of college. But I know today, if there wasn't the Affordable Care Act, I would be denied for a pre-existing condition. I would be uninsurable because of a test that I had a couple of years ago or a medication that I've had to take lately. So I know that I benefit from it, but there's a lot of people out there who, they're just so insulated they don't realize what the worst case scenario could be for them and their family if they don't have these protections.
If they get laid off from their employer and their COBRA insurance runs out, all of a sudden they don't have health care insurance anymore.
I'm glad you mentioned that. I don't want to make this the Dee Dee Sharp show. Okay, maybe just a little bit. But here you have a news anchor of over 24 years who goes to work and has a car accident at work as a passenger in the vehicle on the way to cover a story. And boom, you got this accident while at work that you never thought would happen. And yes, that happened to me. And 18 months later, after COBRA has exhausted, and I've done everything I could on disability to pay this, I find myself with no insurance. And so I find myself, after working for more than 24 years as a news anchor and a reporter, facing some of the very issues that we're talking about and that I'm trying to educate other people about.
Exactly the
So this
point.
is personal and professional to be talking about this subject matter, because I know there are so many other people who are falling in that gap that we're talking about.
could happen to
It
any
could
of us.
happen to any of us. And we said that a little while ago, that we live one catastrophic incident away from potential bankrupt. And so that's something that makes it so important. So it's just, sometimes, as Andrew mentioned, we have to look at the fact that people don't have it because they can't afford it, and then we have to look at it sometimes because people don't really educate themselves to understand what it means to them. And so since we don't want to go back to having to define and that sort of thing, want to use you all's expertise nationally and also locally by starting, first of all, you get calls all the time on the radio. People have all sorts of scenarios. I just gave you one of my own. By the grace of God, I've recently been married, so my husband has TRICARE. He's in the armed military services, so I have that now. So I'm not gonna have to worry about it anymore. But for people who don't have a saving grace like that, something that has caught them, a safety net, they call your radio station. They have all kinds of questions. You have a calculator in the front of you. You've had that laptop open. We're going to let you use it and show what you all actually do for people who call.
So there are resources available now online. Now remember, we started using this calculator, and what this calculator does is it allows us to come up with estimates of what people would pay for healthcare insurance on these state exchanges. Now, we started using this before the healthcare insurance exchanges actually opened, and now we know that we're having problems with the healthcare insurance exchanges, so we're still using the calculator. But in theory, you should be able to do this yourself on healthcare.gov now. As they fix the website every day and make improvements, by the end of the month of November, you should be able to log on to healthcare.gov and do this yourself. But a typical caller would call us up and say, hi, I live in North Carolina. And again, we get a lot of calls from North Carolina. And I am married and I have 2 children. I don't have health insurance because I can't afford it. I make $47,000 a year. I'm making this up, but this is the kind of call we get every day. Family of 4, making $47,000 a year, 2 kids. I am aged 50. I'm not age 50. And my wife is 48, and my 2 children are 16 and 14. So before healthcare reform, someone like this could be looking at a premium of $600, $700, $800 a month on a $45,000 a year salary. That's $10,000 a year for health insurance. There's no way you can make those numbers work. What this calculator does, while I was talking, Matt was putting in the numbers, and tell us what you got.
So basically, with those numbers, a family of 4 making about $47,000 a year, the health insurance would cost about $12,000. But remember, because they make under 400% of the federal poverty limit, there's going to be a subsidy added to that. So the subsidy is going to be about $8,000 a year, leaving about $3,000 to $4,000 for the family per year to pay for health insurance.
Now, we're not using actual insurance plans. I created a scenario in North Carolina. We would have to go on to healthcare.gov, which we can't do because it's not working right now, to have done that actual calculation. So this is an estimate that was put out by the Kaiser Family Foundation. People can go online and play with it themselves, kff.org. And put in their own income, because some people don't like to say that on the radio or on television, and they can see what this estimate of what their subsidy would be. But the key here is, in my fake scenario, I said it would be about $10,000 a year, and Matt came up with $12,000 a year, which is unaffordable for a family of 4, making $45,000 a year. The insurance is still $10,000, but the subsidy, which is a credit, it's not a tax refund, it's a credit. The federal government will pay the insurance company, what was the number, Matt? $8,000?
8,000, just over
$8,000 out of the $12,000 a year premium directly to the insurance company, and the family of four, the individual, will make a payment for $4,000 once a month, 1/12 a month, directly to the insurance company. So you don't have to wait to the end of the year to get your money.
And we get so many callers when we do that for them, they're astonished because they're used to seeing huge numbers and they don't realize that this subsidy will help so much. I don't think they realize that it could be hundreds of dollars of savings for them. I think they think it could be 10, 20 bucks a month, but it's really a large chunk of money. And this is a good example. We just made it up, but this happens on the show all the time, and people walk away, actually going back to the site and hopefully being successful in signing up.
Now, you're seeing about $4,000 a year. What would that? Y'all help me do the math, just for viewers at home, quickly. What is that a monthly?
$300 a month,
$300
$400 a month.
The entire family,
The
mother,
whole family,
father,
right.
and two children,
Right.
all covered, $300 a month. That's less than $100 a piece,
Yeah.
and they're all covered.
Correct?
To go to the doctor,
Correct.
to
With a good
get their-
plan,
with
with a good
silver
plan.
plan.
Again,
This
it's
is
gonna
a
have the
silver plan. It's
comprehensive
going to be
benefits.
comprehensive. There will be a deductible. There will be co-pays and co-insurance and things like this. But for $300, $400 a month before healthcare reform, this wasn't possible.
And
You
for
couldn't get this
screenings
plan.
and physicals, the deductible doesn't apply. So
Right.
for routine preventative health care, meaning staying healthy, it doesn't apply on your deductible.
That
So-
sounds like less than what I paid for a single parent with two children having an employer-based insurance plan for the children.
It is, in many
It was
cases.
cheaper.
Yeah.
You just
It
quoted
is.
me a cheaper
Yeah.
price than what I paid.
Right, so this is your ballpark. I mean, you got to actually go on and see what your prices will be, but there's a lot of people that are getting cheaper prices from this. Now, there are some on the flip side that the cost goes up. I mean, we don't want to make it seem like everybody's going to come into a windfall here. Some costs will go up, but we've seen time and time again costs
More
being
people
reduced.
will save and do better.
For
But
sure.
you don't see that on the news. You don't see what Matt just did on the news. You see the fighting, but that's what we just went through. It was a fake person, but a real scenario.
And a lot of people talk about that because when you think about what's on the news, not to hit against any of my colleagues in that industry, but when you think about some of the things that you hear on the news, it's very negative and it's very scary. So we don't hear a lot of the positive stories of the people winning in these scenarios. So I'm glad that you all shared that with us because
Well, remember,
it's
you're
possible.
a former anchor from your television station. Remember, news is 2 to 3 minute clips. You don't get a lot of time. So
Sound bites.
they're
That's all we have
sound bites.
time
It's
for.
all
We'll
you
spend
get.
30 minutes in an interview
all
with
you
you,
get.
and we can only use 10 seconds of what
Exactly.
you said.
So you can't do what this program is doing, which is why programs like this are so important.
Well, thank you very much. An endorsement from a national
It's true.
radio host.
It's
We
true.
appreciate that. And we're
That's true.
glad to be able to do this here at Pensacola State College and here at WSRE PBS for the Gulf Coast. We wanted an opportunity to educate our viewers and our town hall guests as well, to let them know that the ACA can work for them. And one thing that I have learned personally and professionally, and I've said it before and I don't mind saying it again, is people need to try to get on to the exchange, maybe even call you on your radio show, get the information, become educated, read the fine prints, and bigger than anything, at least shop around. You know the old song, "My Mama Told Me to Shop Around." Not to go there because we don't want any issue with that, but to shop around and to see before you make a judgment about whether or not it's working for you. Then you'll know at that point. Would you all agree with me on that?
I mean, we get a lot of calls also from people who are trying to make some choices and do some research on behalf of their children, their grown adult children or their young adult children. And one of the biggest changes of the Affordable Care Act that already went into place many years ago, actually at least 2 years ago, was allowing children, dependent children up to the age of 26 to stay on their parents' insurance, which is a significant change. So a lot of the calls that we get are people calling to see, okay, well, is it cheaper? Because to get a policy, to go onto the exchange and buy a policy for a healthy young adult, 23, 24 years old, is relatively cheap. So doing the math and looking at the subsidy calculator, and looking at if they have an income or if they're a student, and comparing what will it cost for my adult child to go out and get their own policy or to keep them covered under their employer-based plan. So there's all these different options out there that it just takes a little bit of research, but you gotta, again, do your shopping around, because the difference between doing the research and not knowing what your choices are can save you thousands of dollars a year when you're talking about something like this.
Anybody want to add anything to
We
that
always
before I
say
go
on
on?
the show, be your own advocate. It's the only way that you're going to get this done. If you don't do it yourself, no one else is going to do it for you. So just invest a little time, do it up front, and it'll be much easier than accessing it and trying to figure it out once you're already into the system. So be your own advocate.
I like that because in many cases we have to be our best doctor because only you know about yourself. And in this case, be your own advocate.
Yep.
You are the consumer and you need to be aware.
And there are resources
ahead.
like Corey and Stephen locally who can help.
Absolutely, and let's talk about some of those things, and we can show our viewers some of the resources that we've compiled for you here on the Aware Show. But Corey, I want to turn to you and give you an opportunity as a navigator in this area to just kind of steer people a little bit about, or help people understand about what you do in terms of taking this to the next level. When they're calling you, when they come to you.
They
that
do
sort of
call
thing.
us and can I
Sure.
do the number
Go
here?
ahead. Give
Okay,
it
if
to
you
us
need to
again.
reach one of the navigators, our number is 850-941-7156. What the callers do, they'll call in, we'll schedule them an appointment to see us. It's personable, one-on-one. We go into the healthcare.gov. The customer is able to sit there, apply online. We do not ask for any information from them. They can plug all that stuff in themselves. After they do that, if they're not able to get on the website, we will call it in for them while they're there and try to get them the services that they need. We do a lot of community events and outreach within the 10-county area from Escambia to Bay counties, and trying to get the word out that yes, we are here. We are licensed navigators, and we've been background checked and all that, so we're good to go. But we do have an unbiased, decisions or that need to be made by the customer and not us. We're not going to make a decision about your health plan for you. We'll guide you, in the right decision that's best for you when you do see all those plans come up.
And let's just kind of zoom in and focus just a second here on what we talk about too when we talk about these plans: platinum, gold, silver, bronze. I know you can't every little thing, but just tell us some of the top of each one of those that we need to know.
The platinum. Can we just?
That would take you forever. That would take her forever to get to that.
Bronze,
That's a tough
you got
question.
Bronze, you got the 60-40 plan.
Exactly. I
and
mean, the benefits are all the
silver.
same, which is
Yeah.
the premise of what you're getting here is your essential benefits are covered. The only thing that's really changing here with the different, what they call the metal plans, is what your out-of-pocket cost is going to be. So you get a bronze plan,
Exactly.
your premium is going to be the lowest, but your deductible is going to be the highest. So your out-of-pocket cost at the time of service when you go to the doctor, when you go to the hospital for any services, is going to be more than as opposed to if you go to the silver or the gold or the platinum. So in the platinum plan, obviously you're paying the highest premium.
The
but-
90/10.
Exactly, but you only give your 10% deductible and coinsurance, so it's
Exactly.
the least out of pocket at the time of service. But the benefits are exactly the same.
Okay, the question that keeps coming up is, if younger people do not buy into this, does it work?
No, but they have to buy into it, or they're going to pay a penalty. So,
And we talked about that
and we
earlier.
talked about that. There are called the metal plans, as Corey and Allison said, bronze, silver, gold, and platinum. But there's also a plan for people under 30 that's even cheaper. That's more what we would traditionally think of as a high deductible catastrophic plan. It's even cheaper than the bronze plan with a subsidy. And it's designed to attract the 30 and under year olds into signing up for health insurance. So people ask, think of it this way. I mean, if you're going to insure everybody in this country under age 65, because remember, if you're over 65, you're in Medicare, and we're not touching Medicare. You have to have the young, the old, the healthy, and the sick all in the same pool. There are more healthy people in this country than there are unhealthy people in this country. So it is the healthy people who are subsidizing the unhealthy people, because the healthy people will someday become unhealthy. So we all have to be in it together if it's going to work. And if we leave one group out, then it doesn't work. It's that simple. It's really that simple. And we will all, this is something that your viewers may want to know. We're all going to die someday, and we're all going to access the healthcare system. at some point in our lives.
Thank you for making us aware of
Well,
that.
I think some people forget that sometimes.
Yeah, I do too, Andrew. I'm being funny about
Well,
that.
so am I. Well, no, you don't have to worry. So am I. But I wasn't offended. But
Yeah.
it's an important point. Hopefully you won't need to access the healthcare system that much during your life. But none of us knows that. None
This
of
is
us
true.
knows
And
what's
we don't
gonna
know
happen.
when.
And we don't know
We
when,
don't
and
know
we
how.
don't know how much, and we don't know how bad. But we want to know it's there when we need it.
Well, it certainly makes me feel good to be fully covered on the car. We mentioned that. So it's even better to know that I'm fully covered on myself.
Absolutely.
Absolutely.
Yeah, there's peace of mind that comes with that. We're going to start taking some questions from our audience here at our town hall. We want to thank them for being here, as always, and this can go out to any of our panel here. One of our audience members asked if the website basically is not working, and this has to be discontinued. What happens to the people who bought policies on the exchange?
Good question.
There's some great questions from the audience.
That's actually a really good question. I think, well, listen, if it doesn't work, the government's going to have to intervene and legislate something. What will happen in practical terms is that if not enough insurance companies get enough people to sign up, and they lose money, or they'll just discontinue the policies next year. So you could be in a scenario where if it doesn't work, there are no insurance plans to buy on the state exchanges. I think that's unlikely, as difficult as this rollout has been and how frustrating it's been for people who have tried to go online and get it to work. I shouldn't say it has to. It will most likely get working, and then people will start signing up. So I don't think that's going to happen. But the worst case scenario is insurance companies don't sell insurance products, and the whole law falls apart, and Congress will have to intervene and do something.
Well, I think the other thing that could happen too, talking about the young adults that we want to join the marketplace, if enough don't join, another potential is that those that are in the marketplace next year, their rates will rise to a high level because there's not those healthy people to bring down the costs.
Even with the penalties.
Right, even with the penalties. So people could be looking at the prices that we quoted just a few minutes ago, and then next year, if the balancing act doesn't play out correctly, those rates could go up, and then people are going to be annoyed again because of high rates, because that's the only way the insurance companies will be able to stay in the market, or they'll just get out of the market.
It's a very frustrating and dissatisfying response to hear, but I think the best answer to that question is just we need more time, wait and see what happens, and it's not satisfying. It's not satisfying to me, but it's the only answer right now. The exchange has to get working, and then people will sign up. Or not.
People will at least have the access to do it.
And with the numbers Matt was showing you before, why wouldn't you sign up?
Okay. We need to talk about the deadline because Matt kind of alluded to that in what he was just saying. So let's just talk about some important dates that we need to keep in mind. Matt, Allison, any of you?
Well, it's confusing this year because the deadline for signing up for the Affordable Care Act is December 15th. For coverage, it starts in January 1. For Medicare, the open enrollment period ends on December 7th. So there are two dates very close together that may confuse people. But it's the 15th. But you still can sign up for ACA coverage through the website, through healthcare.gov, and be covered even if you sign up after December 15th. Your coverage just won't start on January 1st. It'll start the month that you apply.
It's open enrollment for year one in healthcare reform up until the end of March 2014. But for people who want coverage on January 1st, which is when most insurance policies will end from the previous year on December 31st at midnight, you want 12:01 a.m., you want your new healthcare.gov policy to be in effect. That has to be done by December 15th. So the window gets shorter the longer the website is not working properly. So by the end of November, which is December 1st, there will be 2 weeks for millions of Americans to go online and sign up 15 days to have coverage on December 1st. But people don't need to panic if it doesn't happen that way, because they'll still be able to sign up, and they just may have coverage start on February 1st instead. Again, a frustrating response, but it will still be coverage. It just won't be on February
Right, you
1st.
need coverage signed up by March 31st to not have a penalty for the year of 2014. So if you sign up anytime before March 31, you're okay. If you wanted to sign up come June 1st, you just paid attention and you wanted to sign up, that option doesn't exist for you. So once March 31 closes,
You're locked out until the
you're
next
locked
enrollment
out.
window.
And you get that penalty, that $95 penalty for year one.
Exactly.
And we have this question also from our audience here concerning that. The audience member who didn't give us their name but wanted me to ask the question, the federal government is paying subsidies. So they want to know, is this where the system fails if people opt to pay the tax penalty? Basically, they want to know if the government would pay their tax penalty,
I'm not sure I understand.
their penalty.
No, the government's not going to pay. I mean, the healthcare reform law is funded by many different mechanisms. It's not just the insurance premiums. It's not just the penalty. And remember, if large employers don't provide insurance, those are employers with over 50 employees don't provide health insurance, they pay a penalty that's actually $2,000 per employee. But that's more. That doesn't cover all the costs of this reform. The bulk of the subsidy money comes from payroll taxes on people making over. Matt can look it up again because I'm gonna botch this. $200,000 for an individual or $250,000 for married couples filing tax returns. So there were increases on the Medicare tax and on payroll taxes to fund this, and that's where the bulk of the subsidy money is coming. The penalties are really just to encourage people to sign up.
And right now, the way it's written, the law is written, the only way the way the government would essentially collect the penalty is to withhold it from a tax return. They can't go out and garnish your wages. They're not going to send you a bill. But if you're due a tax return, a refund, when you file your taxes, they will withhold the penalty from that check.
Okay, and these penalties are accrued over the months through the year.
Over through the years.
That's right. That's right.
And there are some initial startup surcharges that were put in place on employers to fund catastrophic insurance pools. Because, speaking to some of the earlier questions, with all the ambiguity around how this is going to work and not knowing who's going to sign up and not sign up, people got concerned, the government got concerned that there wouldn't be enough money to fund this whole thing. So there's actually a per employee surcharge that was enacted on top of all the taxes, where I think it's $90 some odd per employee that they're paying into an insurance fund for catastrophic costs should they present themselves.
And that went into effect last October, I believe it was.
Last
It was
year,
over a
right.
year ago.
Okay. When we talk about some of the deadlines, as you mentioned, Matt, and you too, Andrew, we talked about that March 31st, 2014 deadline before the penalty kicks in. People, we say people are going to wait because they're going to think that they got that 90 days, and they do, that they don't have to, and when you include this month, then they've got a little bit more time before they actually have to get into it. They're going to wait. And that means more people trying to get in before the deadline. We already have issues. What can you say to speak to that?
Well, I always tell people, there's no reason to wait. I mean, because if you wait, that means if you don't have insurance, then you're not going to have insurance until you sign up. So it makes no sense to wait. And if you can't afford insurance and now you're eligible for a subsidy, why drag that out? You don't, when you get sick, you don't get sick at certain times of the year. You get sick when you get sick. So, you don't want to. The biggest mistake someone can make would be to say, I'll just sign up next year, and then they get sick in June, and then they can't enroll until next October for coverage on January 1. It would be the biggest mistake you can make. So I don't think you should wait, but we know that people will, because that's what people do. But I don't think it's a good idea.
Allison?
And one other thing that we have to keep in mind is that there's all the media hype and all the information out there around people not having insurance, but we have to keep in mind there's still a very significant portion of the country where we get our own insurance through our job. If you have comprehensive insurance through your employer, you're okay. You're not going to hit the penalty. You're going to have comprehensive coverage because your employer is required to now have the comprehensive coverage. So there's a significant portion of Americans out there that aren't really affected by this right now at all, and they're protected, which is good. So I know we're in a panic mode right now, and everyone's very concerned about it, and there's a significant portion of of Americans that need to be concerned about this and get in there and get their insurance taken care of. But if you have insurance through your job and it's continuing, you're okay.
Okay. Want to talk about the fact that I guess some people who are actually signing up, we mentioned they could find that they could actually save money, and then some people are actually finding out that they may be qualified for Medicare or Medicaid, and they didn't know that.
Right. Basically, the 65 and over people are qualified for Medicare if they're drawing Social Security. The Social Security office will let them know that they're qualified for Medicare. The Medicaid depends on the state. In Florida, it's the ceiling is, I believe, 100% of the poverty level, which is about $15,000 a year for a single person and about $22,000 a year for a family of 4. And they're eligible for Medicaid. And they can go on the Medicaid site and check out what their benefits would be and enroll on the Medicare site. And actually on your reference sheet, there is the Medicare site, which is medicare-florida.org, I believe.
And we're going to show that at the end of the show, so you won't have to worry about that, but we thank you for sharing it and offering it up for us. Obviously, we have a very shy group that has been assembled here in our town hall because they're sending me all of their questions, and we are definitely going to answer them if we can, because we promised that if you showed up and you had a question, we would take care of you here on the Aware Show in our town hall on the Affordable Care Act. And this particular audience member basically wants to know, can applicants be denied? Is there a denial of an application?
Corey, you should probably answer
Corey?
that, but yeah, the answer is yes.
It is yes, but I haven't seen that as of the ones I've helped.
So that's good.
Well, we've heard of them. We've heard of them, but when people actually went through their scenarios, they actually were. It appears as if they were denied incorrectly because there were problems with the websites. But let me give you a scenario where you could be. You can. It's not that you would be denied. I think that the question is probably that the writer didn't understand it. Well, you would be denied. Anybody can buy health insurance on the state exchange. It's just a place to buy health insurance. What you won't get is a subsidy. So you could be denied a subsidy if you don't meet the criteria, which is less than 400% of the federal poverty level. So you would be denied a subsidy. You wouldn't be denied the opportunity to buy health insurance. Right. You could potentially live in a state that doesn't expand Medicaid, and I'm not going to talk about that again. That's in part one, but I misquoted. It was 90% of the cost would be covered by the states after a certain period of time, not 95%. You could be in a state where you think you're eligible for Medicaid, under the expansion, which is 133% of the federal poverty level. And if you live in a state where they don't expand it, and the current rules, and I don't know what they are in Florida, Stephen says 100% of Medicaid. So if I make 110% of the federal poverty level, under health care reform, I would be entitled in New York to get Medicaid, and that would be my coverage. If I live in Florida, I won't get it. So I won't be able to I would be denied Medicaid because the state didn't accept the Medicaid expansion. So the word denied is a little bit confusing in that question. Okay. So you would be denied subsidies. You wouldn't be denied, nobody would be denied the opportunity to buy health insurance.
Okay, very good. And I just wanted to give you an opportunity to expand on what Andrew was just talking about, in effect, and that is what has happened here basically in Florida. I think you've mentioned it before, but just to kind of reiterate that. Well,
the state of Florida, the legislature decided not to accept federal funds for expanding Medicaid. So the Medicaid cap on the salary is 100% of the poverty level. Had they decided to accept the federal money, it would be 133 or 138% of the poverty level, which would bump right up against the bottom of the subsidy level for the exchanges, the Medicare medical exchanges. So people in Florida are in that gap, have to look for insurance on their own. They can't participate in the exchanges, and they can't participate in Medicare.
Are those the people in the
Medicaid.
donut hole?
No, the donut
Let's
hole.
talk about the donut hole.
The donut hole is something
Something totally
completely
different. Let's talk about the donut
totally
hole.
If you think
I,
that's- if
I
you
feel
think
like
this
I've been
is-
in the
if you
donut
think this
hole.
is confusing,
forget it.
you-
It's an
the
altogether
donut
different
hole.
thing. So we don't have a lot of time here on the Aware Show to explain the whole thing about the donut hole, but just kind of give us
The
an overview.
donut hole deals with Part D and Medicare, and that's the prescription benefit of Medicare. If you have medication up to about $2,702, or no, about $2,700, let's leave it at that, then your plan benefit for the copay on your medicine disappears, and you fall into what's called the donut hole. Previously, it was you had to pay 100% of your medication. Now, there are discounts for generics, and there are discounts for name brand drugs. For name brand drugs, it's 52%. For generics, it's 18%. And you have to stay in that donut hole until you reach $4,700 out of pocket
Wow.
medication, and then you fall in catastrophic coverage, and that's your copay becomes 5% of your medication.
So if we want to know any of that information, we definitely need to give you a call. Because that's going to get complicated. Did you have something else you wanted to say?
But part of the ACA, the Affordable Care Act, is that donut hole is closing.
Okay.
And by the year 2020, the donut hole will have completely disappeared. And you will go from the coverage on your Medicare plan, whichever Medicare plan you selected, right into catastrophic coverage at $4,700.
So this is going to close. The donut
That's,
hole is going to close.
that's part of the benefit of the Affordable Care Act.
Okay, very good. We have a gentleman who's been waiting at the podium patiently for him to be able to ask us a question here. We want to get to you. Please give us your name and your place where you're from and your question.
Yes, ma'am. And Larry Huntley, Pensacola, and I want to thank all the panel members for being here. Two quick personal stories. A family member just underwent stem cell transplant at MD Anderson in Houston. Cost $750,000 for approximately 10 weeks of treatment. His first stop after diagnosis and recommended treatment was the insurance office, where it was made clear that without the necessary insurance, he would go home without treatment. A second family member recently needed a pacemaker. The cost for just the machine was $98,000. Operating room, $44,000. Hospital cost, excluding the doctors, was $160,000. No insurance, no pacemaker. I guess my question is, nationwide, is this common? Is this what people that are uninsured that run into these kinds of catastrophic medical situations, is this what they face? Yeah. Are they sent home? And you know, we heard early on, and like you folks have already mentioned, there's been a lot of discussion whether you're for or against the Affordable Care Act, about death panels. But it struck me that a death panel is out there if you don't have the right insurance to cover your medical problem. Thank you all.
Thank you very much.
Good.
Andrew.
That's very good.
Matthew, or you, Ruben?
Well, first of all, I want to talk about the death panels. The death panel rumor was started about a coverage that was going to be available in the Affordable Care Act, which was end-of-life consultation with your physician. It was not deciding whether to pull the plug or not. What this gentleman spoke about is very true. The uninsured bear the highest cost for medical care of anybody. Every medical plan negotiates with the hospitals and the doctors for a fee that is reduced from what the hospital classifies as their normal charge. People that don't have insurance get the full boat. They get 100% of the charge. And if you're treated, for instance, in the emergency room, which has to treat you and stabilize you and then send you home, you get a huge bill, and you are liable for that entire bill.
In practical terms, I mean, and we do get questions like that on the radio show. You know, you can negotiate, which is always difficult, but you know, most reputable hospitals will negotiate rates with you. But the fact remains, if you're one of those people who has no insurance, you're out of luck. And then you fall to the state system for support, and that, you know, that varies based on where you live and the state system, resources that are available to help you. So, you know, in New York, we have a fantastic public hospital system, and there's other states that don't have a very good safety net system. But even in those public hospitals, you're still liable to pay the bill. No, in practical terms, if you don't have the money, you just don't pay. So it's just an unfortunate situation that this will fix.
It is, and even if they negotiate, you can't afford it. Some
Exactly.
hospitals do offer you a payment plan, but if you can't afford insurance, you probably can't afford a payment plan.
Exactly.
So it's like a double-edged sword.
And the cost of treatment that's uncollected is recouped by the hospital by adding to the premiums, in effect, adding to the premiums that people pay on their insurance, because the hospital is going to get their money.
They're
just
going to get
makes-
it one way or the
It
other.
makes our premiums higher.
So that brings up the question that we asked when we did this program similar to this on healthcare reform in 2009. I'm glad that we're doing it again now. Brings up the question of what is the cost of doing nothing? If we hadn't done this, what would the cost be? If we don't have health insurance and we end up at the hospital and we end up with those types of bills for the hospital, we don't have the money to pay it, the hospital has to absorb it. Who ends up paying that?
Well, I think Stephen just he explained it. I mean, we all end up paying for it as you know, through higher premiums and higher taxes, because in addition to higher premiums, there's something called a disproportionate share pool, where states get additional money based on the state and you know, where they get the money from, surcharges and so forth, and they give hospitals money to treat to pay for uncompensated care. But you know, I would phrase it slightly differently, or I think about it slightly differently. You know, this is the country, the land of opportunity, and the place where most of the most fantastic scientific discovery has ever taken place. More drugs are developed in the United States than anywhere else in the world. More technology for the treatment of diseases are developed in this country, not exclusively, but predominantly in this country. We have a fantastic healthcare system. With all these terrible flaws and scenarios like we just heard from, I think Larry was his name. So we can do better. This is the one piece that's missing, is this insurance protection for everybody to access the healthcare system. To me, it rounds out the picture and makes us a truly complete society when it comes to taking care of the people who need health, you know, good health care.
Do you have anything to add to that, Allison?
Well, I was still thinking about the scenario that Larry was speaking about, and it's those people, it's those patients, those two patients that went through those horrible situations, and you know, avoiding that in the future. And that's why, you know, your question was, you know, what would happen if we did nothing? They'd be bankrupt, or you know, they'd be paying granted, they'd be paying, maybe make a deal with the hospital and a payment plan and be paying as much as they could every month for the next God knows how many years. And just because you're unlucky, I mean, just because I'm unlucky and I get lymphoma and the person next to me doesn't, it's a horrible system to live in, that it's the haves versus the have-nots, and it's pure luck. And that's not really what our society is really based on. We're trying, you know, that nothing else I feel like in our country works like that. You know, you work hard, you earn something, you should get it. But when it comes to our basic health care, we should all be able to, it should be an equal playing field. And if we did nothing, it's still an uneven playing field. And that's what the goal of the Affordable Care Act was, to just level it out for all of us.
Okay, and protect us.
Protect us, of course.
Okay. We want to go to a question from a woman who emailed us shortly after learning that we were going to do this town hall. And so we want to get to her and her basic situation. She was very upset. She called and she also emailed. She was very upset. She's 61 years old. She says she's bedridden and does not have a computer. She couldn't come to the town hall because she didn't have transportation. So you're here now. Thank you for this email and thank you for your call. Briefly, this is what she says her situation is. She's been told her individual insurance will be canceled because of the ACA. She lives on a Social Security income. She was told that if she earns more than $17,000 a year, she would not qualify for assistance. Her Social Security payments exceed that by $400. So she was told that a health insurance policy under the ACA would cost $1,500 a month, leaving her without money for food, medication, or even lodging. What can you do what can you say to help, Andrew, Matthew, any of us? Ruben? I'm sorry, I keep wanting you to be Ruben. Stephen.
Stephen. Well, maybe I am Ruben. I don't know.
Ruben has two first names for a last name as well, so I'm sorry. Go ahead, Stephen.
Well, at 61, she is falling in an interesting place. The Medicaid in Florida is capped at 100%, and it's a hard cap. And unfortunately, she is falling in that portion that's not covered by Medicaid or the state insurance, the federal insurance exchanges. So she is going to have to call one of the agencies in town, 211, United Way, and see if they can arrange some assistance for her.
She may eventually, if she's on Social Security disability and she's disabled, we have to find out how long she should be reaching out to Medicare.
Well, she should try Social Security SSI,
yeah.
Which is the disability payments if she's bedridden. She may qualify for that.
I think she said she's getting Social Security.
She
so
did.
she's
She is
That
getting
is
Social
another
Security
avenue to pursue.
if she's bedridden, if you're disabled and getting Social Security benefits under age 62 is when early 65, that means she's disabled, and there's a 2-year waiting period to get into the Medicare program. So and it's based on the date you became classified as disabled. So she should, I think Stephen's right, reach out to a local agency to help her or contact Social Security directly if she can, and have someone help her apply for Medicare, because it sounds to me like she would qualify. If she's disabled, even with the Medicaid threshold at 100% in Florida, which I'm not familiar with Florida Medicaid, she may still qualify under some other Medicaid loophole that would get her in. So she just needs to talk to somebody who can help her navigate.
The best agency to talk to is SHINE, which is run by the Northwest Florida Area Agency on Aging, and that they're on your reference sheet that I think everybody in the audience picked up. They have counselors that can talk to people and take their individual case and figure out which the best approach is.
Do you have anything to add, Corey, as a navigator?
Yeah, well, the 211 service is a good one, but she didn't have to have a computer to apply. There is the 1-800 number she could call, or we can make arrangements, to set up and to help her. Absolutely.
Let's give her. Do you have that 1-800 number right quick, since we're just talking about it?
Yeah, she can call the 1-800-318-2596. That's the national number to call, and they can get her applied and answer any questions she may have.
And that number, by the way, is on your reference sheet.
Okay, very good. Your name is not important, but your situation is. We'll keep you in our prayers, and I thank you all.
I just want to add, the only way Florida will expand Medicaid to include the same Medicaid benefits that you would get in states where they have accepted it, so that would protect this emailer, is if people who are watching the show and people who are in the studio audience contact their state representative to tell them they want it to change, because it's decided locally. It's decided by the state, and the state has to want to pass or accept the money. And Florida, and I think there's 22 states, Matt, have not expanded this. So there are a lot of people like that emailer who are stuck, and the only way you get unstuck is by people who are hearing this scenario, being upset about it and outraged by it, and contacting their state representative to say, fix this, and then it'll pass. But if they don't do that, then it will not expand.
Okay, and there you have it. And her name is Linda. I just read that on there. So, Linda, you have the answers, and hopefully that helped you to get some information to help you with your situation. Our prayers are with you. We are on Pensacola State College's campus, so it's only fair that we would get a question from one of the students as well from our audience. The student wants to know, within regards with health insurance, how are they going to be affected by the Affordable Care Act, and the biggest change that they could expect?
So as a college student, someone in their late teens, early 20s, if we're talking about that demographic, like we had mentioned earlier, there are some changes in the Affordable Care Act that went into effect 2 years ago that allowed young adults to stay on their parents' policy up to the age of 26, which is a significant change. So if the parents have their insurance through their employer, a lot of employers, they had to offer that as well. And also, a young adult can go onto the exchanges and purchase their own insurance as well. And based on your income, if you're a full-time student, you may have very little income. Depending on where you live, the state that you're in, you may qualify for a significant subsidy as well. Or you may want to purchase what Andrew was talking about earlier was the catastrophic plan, the Young Invincible plan, which will qualify you to have coverage through the ACA. You will not be responsible for a penalty, but you'll have a comprehensive benefit plan available to you.
Okay. Anybody else on that?
Yeah, I think a lot of students used to go to college and sign up for like a mini medical plan through their college. Now those plans won't really exist anymore because they won't meet the essential benefit package. So really going through either your parents or potentially if the college has expanded it, or just going right to the exchange is going to be the way to go.
All right, we'll move on to another question from our audience. One of our members asked, I successfully completed an application online on November 2nd. At the end of the application, it stated it was unable to complete and is still in process since that time. What do I do? That's a question for you, Corey.
Yes, it is, and we have run into that a few times. What they need to do is call me, and I'll meet with you and we will get that straightened out. We have run into some issues where it says in progress, sometimes a day at a time, sometimes a week at a time, and that's where it's staying in process. So if you would contact me and we'll get it straightened out for you, okay?
I'm just going to ask this question from one of the audience members. I'm sure we can answer it. What is the locator of the exchange at Santa Rosa and Escambia County? I think they probably got a little confused with that, but I think we could probably still answer it. Basically, how would they probably get to you is probably what they want to know. I would think that's what the
Families
question is.
Count, the corporate office is at 422 North Bayland Street in Pensacola. We also have 5139 Elmira Street in Milton. We also have an office in Fort Walton Beach on Miracle Strip Parkway, and we've got a new office in Marianna, Florida. So there are 4 locations right now serving the 10-county area in which we can go to, but we're providing services, throughout that 10 counties. If they call us, we'll be able to set up, a time and a place that benefits that customer. And we take a lot of appointments and all, and we want to be able to give that one-on-one time. And I would like to stress it does take an hour and a half for these appointments, so that we can make sure that we get the right information and guide that person to make good decisions. And in good faith.
Healthcare.gov, the website where you can fill out the application. Also, the part that actually is working is it's a very good resource for answering a lot of your questions.
Yes.
So Corey is a fantastic resource, but she's one of 4 people
for this area.
for a very large area,
Yes.
and we're talking about hundreds of thousands of people who need to sign up. So it could be very hard to get to Corey pretty soon.
Yes.
Healthcare.gov has a lot of good information available, and that part's working now. And in fact, we get a lot of our information from there, because this is confusing stuff. I mean, I misquote statistics all the time because it's impossible to remember all this. And healthcare.gov is the source for how this works, and it's written for people to understand it. So it's another
So a lot of your
resource.
questions can be answered simply by just
Absolutely.
going to healthcare.gov as
Yep.
well. Okay, we're going to be showing a list of resource information as we promised during this segment of the Aware Show as we're doing a town hall here and giving our guests there and you there at home an opportunity to ask our panel of experts nationally and locally questions that they might have concerning the Affordable Care Act, and hopefully we're giving you an opportunity to hear some of the answers to your questions. And this question also coming from the audience now as we continue to show some of those resources there on our list that we've compiled for you. They ask, since Florida does not have a state exchange, and you've been talking about that, Andrew Will, are the government plans going to be comparable in price with the state with who have plans?
So
the states who
the
have
state exchange, that question, it's a good question because it shows you how confusing this can be. The insurance products are sold in every state. All that the website does is, the website, as Matt described it before, is where you go to shop for it. So the insurance plans sold in Florida, in this area in Florida, because it's regional, are the insurance plans that are sold in this area in Florida. You just go to a federal website to get that information and enroll. So the pricing, the way the pricing works is what we pay in New York or California or Missouri or Florida, it's all different because insurance is sold by state, by region. So the prices that you're going to pay in this part of Florida are the prices that are available to consumers by the insurance company in this part of Florida. Now, a couple things that the Affordable Care Act does do for consumers. You don't pay more because you have a pre-existing condition anymore. There are only two categories of conditions that cause you to pay more for health insurance, and even those are regulated under the law. So you will pay more if you smoke cigarettes, and you will pay more based on your age. But those are capped by ratios. So that you can't charge someone 50 times more because they are 62 versus someone who's 30. I believe the ratio is 3 to 1, but it's about 3 to 1. So those are the only two variants that cause you to pay more for your health insurance. But the rates you pay in this part of Florida are going to be different than the rates you pay in Miami. And they're going to be different than the rates you pay in Atlanta or Columbia. They're all going to be different.
And it's always been like that. That's not changing.
Okay. In wrapping up, just a few seconds here we have. Want to give your listeners and potential listeners an opportunity to know how to get in touch with you, Andrew, Allison, and Matthew on your radio program.
So you don't have to be a SiriusXM subscriber, but we want you to be. We're live on Thursdays, 12 noon Eastern time, so that would be 11 a.m. locally here, Central Time, and we're SiriusXM channel 81. Our phone number is 877-NYU-DOCS, but in all fairness to anyone who's watching or in the audience now, the shows are already pretty busy, so if you can't get through, I apologize in advance. We're just...
And you're going to get even busier because people are watching the Aware Show.
It's always been busy. It's been even busier. But we do. That's all we do is take questions.
Healthcare Connect.
Healthcare
It airs
Connect.
on the SiriusXM.
But you know what? You just listen to the show, and you'll frequently a lot of people get their questions answered just by listening to someone else's question.
I get that feeling. All right. Want to thank you all for joining us here for the show, as always. Thank you, too, for being here. This has been an Aware Town Hall on the Affordable Care Act. Hopefully you know more now on how it works for you. I'm Dee Dee Sharp saying until the next time, stay informed and stay aware.